Okay, let's get going. For those of you who don't know me, I'm Catherine. I work in Brussels for Lungs Europe, which is the partnership between ELF and ERS, and we run the grants programme. So a few things about today's event. So as this is a global grants programme, our expectation is that we're going to have a global audience today. That means if you want to look at the simultaneous translation availability, then you can. You'll find the link to the chat box to the Zoom page. Sorry, you'll find the link in the chat box to the Zoom page, which will take you to a site where you can choose your language. Hopefully that will make it easier for you to understand, and I will try and speak nice and clearly so that the AI translates better. It's not perfect, I'm afraid, so it is more of a good help than a perfect translation. Apologies for any strange translations that do come out of it. So today we're going to focus on Healthy Lungs for Life grants, and really about the impact that you can make in your own community by applying for one and using one. We offer a €1,000 grant to help support different Healthy Lungs for Life activities around the globe. And today we get to talk to a few of the previous grant winners about their projects and how they made an impact and how the grant helped them to carry out their work. We have three very inspiring presentations. So the first will be from Dr. Abdul Manan from Helping Hands Foundation in Pakistan, and he was a grant winner in 2022. Then we have Lyudmila Anastasov from Charity Wheel NGO in Moldova, who was a grant winner just last year. And also Pamela Bakar-Bulindi, who was a health support, who was part of the health support initiative in Uganda. These are all really wonderful examples of what can be done with this €1,000, and we really hope this helps you to develop your own applications. And before we head on to the presentations, just a little bit of housekeeping. So the chat function and the Q&A should both be working nicely today. We really encourage you to engage and be interactive in the chat box. You can talk to each other, say hello, tell us where you're coming from. And it's a nice way to show that we're all part of the meeting. But please do put any of your actual questions into the Q&A box, because it is easier for us to then pose those to the right presenter at the Q&A points. There's also a team of people who'll be answering as many of the questions they can throughout the event. Please keep in mind that whilst we will do our utmost to answer questions, we can't answer questions about everyone's applications, but you are really welcome to email us afterwards if you want to talk to us in detail about what it is you're planning and if you think it fits with what we're looking for. Also, if you see some questions which you think could really be doing with being answered, then use the thumbs up icon to get them to the top. You're entering the meeting muted. We'd like you to remain so throughout the meeting. It just makes sure that we don't get any feedback coming through and we can't hear any of your background noises. So please, again, use the chat to let us know what you're thinking, but do stay muted. If you're on social media, we'd love you to share that you're part of this event today, and also share some of your highlights and your thoughts. If you want us to see your posts, then please use the hashtag HLFLGrants2025. Finally, the event is going to be recorded today, and we will make it available on the ELF YouTube channel later on, and we will send a follow-up email with the link after the event. So I think Nadine's launched a poll, is launching a poll. This is our entry poll. It just helps us get some really useful information on who you are today, who's attending, and how we can make these events more useful for you in the future. If you could just take a moment, please, to answer this, and there'll be a follow-up one at the end as well. I don't think we've got too many polls today because we're hoping there'll be lots of questions. Okay, I can see about half of the people have answered it so far. I'll just give you another minute. Okay, if you want to end the poll, Nadine, and share the results, and then we can have a look. So we've got a lot of people from patient organizations, but also healthcare professionals and researchers here today. That's great. And mostly women, which often happens in the health sphere. I can't see which countries people are from, but we know that there's definitely a nice spread. Okay, well, let's get started. I think that's probably enough from me. And let's move to lung function testing in Pakistan, which is the project that Dr. Abdul Manan ran with his grant. So yes, please do put your questions in the Q&A and we'll answer them later.
Hi everyone, it's Dr. Abdul Manan from Pakistan. Can everybody see my screen?
Yes, we can see your screen, Dr. Abdul.
Sure,
I'm
thank you.
not sure if you can also share your video so we can also see you while you give the presentation.
Sure. Yes.
Yes.
Okay.
Wonderful. Thank
you. Sorry. So our topic is Breathing Easy, the Healthy Lungs for Life 2022 report, which the project we did in 2022 with the help of ELF and ERS in Pakistan. So Helping Hand Foundation is basically a non-profit organization dedicated to improving public health and well-being through awareness, screenings, and free medical services in Pakistan. So our mission is to create healthier communities by providing essential healthcare services, promoting disease prevention, and spreading awareness about critical health issues. Our key initiatives are free health checkups and medical camps, public awareness sessions on prevalent health concerns, community outreach and support programs, collaborations with healthcare professionals for early diagnosis and treatment. So in 2022, we did a few activities in our HLFL 2022 grant. So first one was we managed to organize lung health awareness in schools. We conducted awareness sessions in schools to educate students on the harmful effects of air pollution and smoke on lung health. These sessions also provided practical precautionary measures to reduce exposure and protect respiratory health. After these sessions, basically, we managed to, in these sessions, over 750 plus students attended sessions across multiple schools. Students gained knowledge about the causes and effects of air pollution and smoke, learned preventive methods to protect lung health and reduce pollution, and sessions were fully covered and shared on social media for wider outreach. After these sessions, we managed to organize a spirometry camp for school children. As far as they got the awareness, they were keen to know about their lung health. So we managed to organize a camp in which, as part of our mission to improve lung health, we organized free spirometry camps in schools located in high pollution areas. Our impact: provided early detection of asthma and lung issues, identified high-risk areas for targeted interventions, shared reports with school administrations and parents to ensure proper medical care. We targeted those who had an abnormal lung function test, and asked the school and also the parents to go for the checkup for the lung health. We raised awareness and shared findings to encourage action engaged with local healthcare providers and authorities to advocate for better asthma care in schools. After this, we shared these reports with the stakeholders and local community to monitor the lung health in that particular area where the lung function tests were in high in number in abnormal. 500 plus students received free spirometry screenings across multiple schools. After that, we managed to organize a lung health awareness sessions in our community. We organized lung health awareness sessions in communities severely affected by air pollution. These sessions focused on educating residents about the impact of pollution on health and provided practical strategies for reducing air pollution at the community level. So over 50 patients received, sorry. So in these in these sessions in community, we managed to acquire almost 150 plus participants from different houses and different homes to gather them and to let them know about the lung health awareness and the preventive measures to maintain their lung health. After that, we managed to arrange a free lung checkup at Lung Health Clinic. We run a lung health clinic through our NGO. So we provided free lung health checkups and medications for patients and students with abnormal spirometry results, along with fortnightly follow-ups. Over 50 patients received free checkups and treatment, addressing the gap in affordable healthcare. Ensure timely diagnosis and treatment prevent conditions from worsening due to financial constraints. Events were covered and shared on social media to raise awareness of available healthcare services. So what we did was we did when we did the spirometry health camps in the schools, we marked the abnormal lung function tests, and then we called those students to come to our camp, free lung checkup camp, and then there we did then we did thorough examination and further testing. And if there is really a problem, then we manage to give them the medicines and also the fortnightly follow-ups. Grant allocation. Basically, the 1,000 euros of HLFL grant 2022 was utilized to successfully execute lung health awareness and screening initiatives. Awareness campaigns, basically the design, printing, and distribution of educational materials, all the brochures and the educational pamphlets were distributed in the students and also the female representatives of different houses, including banners, brochures, and posters. Project execution, logistics, coordination, and facilitation of spirometry camps, awareness sessions, and free checkups. Event arrangements in the venue setup, transportation, and procurement of necessary equipment for smooth operations. Impact is enabled wide-scaled community outreach benefiting over 1,300 to 1,500 plus individuals through screening, education, and free healthcare services. So after this remarkable experience, we are looking forward to apply in the HLFL grant 2025 too. Thanks.
Thank you so much for that presentation. I think it's incredible that you were able to work with so many people to give 500 spirometry tests to children and to reach 1,300 people altogether. It's really quite a great achievement. So please put questions and answers into the box, and we will come back to you later to ask some more questions. I'm sure I've certainly got a couple already. Okay, thank you. And the second speaker today is Ludmila Anastasov. She's the coordinator of Charity Well in Moldova. So Ludmila, if you want to share your presentation.
Yes.
Thanks so much.
Can I share by myself?
Yeah, I think it's better because then you can move through as you want to.
Yeah. Okay, I can start, yeah. Hello, everyone. Yes, and from the first, I would like really to say that it's really good project, and I enjoy to participate in such of the wonderful project, and wonderful people was around me, and I really inviting everyone to participate in such wonderful project to make our world more bright, more healthy. And I would like to speak about my presentation, and I hope you would like it. Let's go. Well, my name is Ludmila Anastasova, and I represent the Charity Wheel organization from Moldova. Our mission is to support public health and educated young people. Today I will tell you how is the Health Lungs for Life grant helping us to conduct an educational campaign in schools, in hospitals, Okay, continue. Well, and our event was held under the slogan, Healthy Generation and Healthy Lungs, helping to promote the message of an active and healthy lifestyle without harmful habits like vaping, smoking, hookers, and passive active smoking. Yes, here on the picture you can see some of the teams of the volleyball we organized, and all of them, and nobody have any harmful habits, and I was really happy about that. Like I said before, many people young in Moldova suffer from lung disorders. It's like harmful habits, and however, information about prevention is limited. And the statistics say that every 10 seconds, someone in the world died from a smoking-related desires. And just try that, imagine taking a deep breath, and now you imagine it's your last full breath. It's look really horrible. Well, and what we did in this project, our project covered around 270 school children, and we printed around 1,000 booklets, conducted lesson and consultation with the doctors, and sport became very important parts of our program, and children learned how physical activity helps to maintain healthy lungs. And what else that's in our project, let's continue here. Yes, here you can see in the corner our booklets, and we try to describe all the desires and how it's really dangerous for youth. I put some pictures about that we printed caps and balls, many trophies like the volleyball event. And here in the school, we participated around 5 schools. And I think in our project was more than 1,000 people, because we especially make promotion even in Facebook, and we have many volunteers who really help us to make promotion of all these events. Well, yes, here in the picture you can see how it was in the school, and what was really a positive impact that students was very curious. Some of them really have already such of the harmful habits, and they said, what is the wrong if our parents do it? And I try to explain how I can that this is bad, and that we have here accident with 40 years old guy who just used e-cigarettes, and he died. Yes, it was not it's a bad experience, and I just explained them that's how it's working. Yeah. Well, for example, here is the mayor of the Comrades city where I live, And especially we used local doctors who supported our campaign. And it was very good trust between the community and public health officials. And the project involved sport coaches and volunteers, how I said before, integrating health education with physical activity like volleyball. And we have many sports here in our city, and we just choose the volleyball. And local hospitals, clinics, and municipalities distributed brochures, increasing their accessibility. And the positive impact was that many participants expressed that quiet smoking or reduce exposure to harmful substances. And youth who attended this session gained a better understanding, like asthma, air pollution, and all these desires from the harmful habits, of course, yes. Well, conclusion, yes, that's the main part of this project. Was how the grant helped us. The €1,000 grant allowed us to print our set information materials, push sports equipment, and organize all the events. It was a beautiful event with parents as well. This small contribution gave us the opportunity to influence the minds of the hundreds of children, parents, teachers, and random people on the street. Our project has proven that even small investment can lead to a big impact. And we plan to expand the initiative to involve more schools. And I encourage everyone who is here to participate in 2025 grant program and contribute to the health of your communities. And I really appreciated to, how I said before, to enjoy this team. And that project inspired me and also 1,000 people to be useful for this world. Yes, and how I said here in the picture, that positive impact was really cool. And I would like to over my presentation with such of the slogan that every breath matter. Let's take care of our health together. And thank you very much. A huge thank you to all participants, volunteers, and partners for their support and dedication. Thank you very much.
Thank you so much, Ludmila. I think it's great that you had such support from the local community. And I think that can make such a difference, especially when, as you say, it's quite a small amount of money. But if you have the support from the community, that €1,000 can be quite transformational for your project. So congratulations on everything you did. And thanks again. Okay, now we're going to hear from Pamela. Becca Bolindi, who is running a vaccination initiative in Uganda. So something else that's very important. We've got lots of great activities improving the health of children in this selection as well. So Pamela, over to you, please.
Okay, thanks, Catherine. And hello to everyone who's joining us today. So today I'll be talking about the celebration of the World Lung Day that we held last year in 2024. And our main theme was vaccination for healthier lungs. And we did this in Kayunga, a remote district in Uganda. My name is Pamela Bakavlindi, CEO Health Support Initiatives. Okay, so I'll run you through health support initiatives, the background of the World Lung Health Embed campaign, our goals and objectives for the campaign, our targets, what we did, what we achieved, and the challenges we had, the strengths and successes, and our future plans. So at Health Support Initiatives, it's an NGO based in Uganda. And basically the mission is to improve childhood immunization completion rates. And the main vision is to improve child survival rates through equitable use of vaccines. We work in remote and hard-to-reach areas to deliver these vaccines. So we received a €1,000 grant. And the theme for last year was clean clean air and healthy lungs, which resonated with what we do at Health Support Initiatives, and wanted to highlight the connection between vaccination and lung health. And we all know that vaccination is one of the most effective ways to protect children from severe respiratory infections such as pneumonia. So when you give them timely vaccination, then you're able to promote lung health. The goals and objectives of the World Lung Day event that we held, we wanted to raise awareness about healthy lungs through vaccination in children. And what our objectives were to sensitize the community, including the community leaders, the caregivers of children who are under 5 years old, on the importance of vaccination and its promotion of lung health. We also wanted to sensitize the community on how to promote lung health by preventing indoor air pollution. In Africa, we have a lot of households that use firewood and they cook inside the house. So we wanted to promote how to prevent indoor air pollution so as to promote lung health. And wanted to conduct actual vaccination of children at both the static health facility and the outreaches. So in regards to our targets, we wanted to reach at least 300 caregivers of children under 5 years through door-to-door sensitization. We wanted to sensitize at least 1,000 community members through meetings, radio talk shows, posters, and banners that we printed. We wanted to vaccinate at least 300 children at the health facility and through outreaches. So the activities that we did in celebration of the World Lung Day, we did door-to-door campaigns. Here we use community health workers, they're known as foot soldiers, who visited households in the remote areas and educated the household members, especially the mothers and caregivers, on the use of vaccination to promote lung health, but also the use of clean air. We also did advocacy and social mobilization, where we engaged community leaders, the health workers, and here we used posters, banners, community radios to do this advocacy. Also, we did vaccination. We did 2 outreaches in very remote areas, and we also did vaccination at the static health facility. So what did we achieve? We're able to sensitize more than 350 caregivers through the door-to-door campaigns. We vaccinated more than 400 children, more than 30 community leaders, including the religious and clan leaders, were sensitized, and more than 1,000 community members were reached through the media that we used. So we had challenges, of course. We had challenges such as the rainy weather that made the door-to-door sensitization a bit challenging. We experienced some vaccine hesitancy in some households, and in some roads in some remote villages were very impassable. However, we still registered strengths and successes. So the strengths were able to engage the community leaders who are very key, and also engage the caregivers of children. We engaged the community health workers, and we had an extensive media outreach. So the success of this event is that we were able to raise awareness on the importance of vaccination and how to promote lung health through inhalation of clean air. By this, we also increased the vaccination rates of children, including the zero-dose children. We had some zero-dose children and unimmunized children who got a chance to be vaccinated and caught up in their chat. So our future plans are to continue promoting lung health through timely vaccination, continue sensitizing the public about avoiding inhalation of polluted air, especially the firewood for cooking. We shall continue to enhance community engagement and address the vaccine hesitancy. So I'd like to thank the funders, the participants for making this event successful.
Thanks so much, Pamela. That's really interesting. I've got lots of questions for you as well, but I'll save them until the end. Okay, I'm going to give you a quick presentation now on the grants themselves, which will hopefully give you a bit more information and again inspire you to applying for your own grants this year. Okay, let's go to the beginning. Okay, you all see this okay? So what is the Healthy Lungs for Life grant programme? So each year we launch our grant scheme and we offer around 10 grants of €1,000. This might change depending on whether or not we've had funding from other partners. A big thanks to FERS, actually, to start with, who have been supporting this grant scheme for the last few years. Last year we had extra grants because Clean Air Fund also gave us some support. But for this year, I think it's going to definitely be 10 grants. We use this to support our partners around the globe to deliver Healthy Lungs for Life events and campaigns. And so far, the grants have actually funded more than 60 events in 32 countries around the world, which we wouldn't be able to do ourselves, of course. We only have very limited capacity. So it's great to be able to offer this as a way of really expanding the Healthy Lungs for Life programme, which leads me on to why do we do it? Well, one of our key aims in ELF and ERS is to improve knowledge of the importance of lung health globally. But that's not up to us to do. We can't go around pushing our model of what lung health knowledge looks like on everyone. And by working with local partners, you can definitely identify actually what's the priorities for your areas. You can really engage your local communities, as we've seen from the presentations we've just had, in a way that we would never be able to do. And so by supporting you, we can have a much, much greater impact. And we are really amazed every time we do this about some of the projects that come back. And there's such a diversity as well. So we've seen some school projects today, but we've also got bike rides. We fund health workers to run events inside hospitals. There's such an openness to the format that it can be, up to you to be really creative with what you might want to run. So how can you apply? Each year we launch the grant scheme. We're going to be launching it today because of this event. So it's a bit earlier, I think, than normal. And you can, that's an issue, that slide. So I think you should have the link coming up in the chat box. If not, do sign up to our newsletter and also look at our website, which will have more information. The webpage will give you lots of different previous grants that you can look at to find more inspiration should you need it. And also it will give you the outlines of what it is you need to do and what you need to include for this year's grants. So we're asking people this year to focus on youth-led projects. Now, this doesn't mean it's exclusively youth-led. It just means this is something that might be prioritized. And what do we mean by youth-led projects? Well, I think we can all agree that if we can get people to change their behavior early on, it makes a big difference. So it's certainly about not vaping and not smoking. And if we can get the young people to lead on those projects themselves, then we believe there'll be more impact from it. And it's not just smoking and vaping, it's also around vaccination, air pollution, taking the active option, and fighting climate change. The deadline this year is going to be the 9th of May. It's a bit earlier than we have had previous years, but we really want to get the grants out so that people can organise the projects ahead of World Lung Day. I think if we try and focus around this date, it really helps us to increase the impact by using this opportunity to give everyone a platform to demonstrate their events. So my top tips for writing your application: please do make sure that you read the supporting documents before you write your application. We try and give you quite an open format, but there are some things that we ask for. And if you don't include it in your application, then you're less likely to get through to a winning round. So yeah, very, very highly recommend you do this. Think about how your project aligns with our themes and objectives. So please look at the Healthy Lungs for Life campaign page, see what we've been doing. Is there anything that kind of resonates with events that we're running that year? Because we love being able to support people further by tying them in with our own activities. Please tell us how you're going to maximize your impact. It makes a big difference, especially if we've got a couple of events that have similar themes or focuses. If one looks like it's going to really have a massive impact compared to the other, we will choose them. And again, from the presentations you've seen today, you'll be able to see how big an impact we can have from these €1,000 grants. Try and write simply and clearly. We don't need lots of technical language or jargon. And as we ask people to write it in English, we understand that might not be everyone's first language. And the best thing to do is to just write in the most simple way possible to get your message across. We don't get more impressive. You've got complicated sentences and bigger words. It really is. Just tell us what it is you're going to be doing. But also be creative and ambitious. There's a really wide range of what we can do, and we can really make some valuable change. So the ambition is always comes through. It's, I think, really telling that the presentations today have done so well, and it's because we've had ambitious people leading those projects. I just wanted to finish on a quote from Maria Neira, who's from the WHO, and I think it's nice that we were able to have this just to say that, you know, the Healthy Lungs for Life is an essential initiative to highlight the harmful effects of poor air quality on health and to prevent its devastating impacts. And I think when the WHO is now recognizing that this campaign, and not just us, but the partners who are using it, is actually really useful to make an impact in communities and to help to start improve people's health. It feels like a good achievement for us and for everyone else who's taking part in it. Okay, so again, thank you to FIRS for your support. And I'm going to finish my presentation there because hopefully we'll have a little bit of time for some questions from everyone from the audience. So I've actually only got about, well, not a huge amount of time left. Okay, so first we have lots of interventions being put in place on the communicable lung diseases such as TB, but not so much is being done for non-communicable diseases. What plans do we have to support this? Yeah, I think really the campaign is mostly able to support in a prevention way. So with and non-communicable diseases, they are caused quite regularly from environmental aspects. And so by raising awareness on the importance of not smoking and, for example, not using indoor fires for cooking, as we've seen from some of our grantees, I think that can be the best way that we can help. I hope that answers your question, but if it's not, then please do get in touch and we can talk to you a bit further, Richard. I've also got some questions for our presentations. So I think we'll go to Dr. Abdul first. How did you promote your event? You had so many people taking part. I was just interested in how you let everyone know that the event was happening.
Yes, sure. Sorry, I didn't get the question.
So what did you do to promote your event? You had a lot of students taking part and a lot of community members. How did you get them all to take part and come along?
Yes. So what we did was, it's a very good question. So we missed this part. So what we did was that we initiated a campaign before the event, which was in the community. We did the door-to-door campaign. And also we have these healthcare workers routinely doing healthcare related activities in the community. So somehow the community, people, they are familiar with our organization and their activities. So they knew, but we particularly did door-to-door campaign of 2 to 3 days in the community to reach out to every house, and even in the schools we went to the schools in different days before the event and asked them for the particular time slot for the campaign session, so that the maximum student can be free in that time and they can participate. So that's how we maximize our participation.
That's great. And I think, again, it just shows how it's important to have local partners running these events, because it's from your reputation, I think, and the previous work that you've done, that you were
Yes.
able to engage so many people.
Yes.
Ludmila, so I think it's wonderful that you engaged your local government as well, and you've got this level of support now, which hopefully will set you up for future activities. But how did you do that? How did you go about getting this support and talking to people and getting them to buy into the project?
Well, before I'm also vice president of the international inner wheel company around the world. Yes, and our members is many kind of level of the people, and there isn't from the government, and some of them is mayors or something like that. And when I say about your project, you know, and everyone said, no problem, we will help you. And for me, it was very easy, because I just done a call, and everyone helped me, because I'm long time doing charity work as well, and we help many orphans people, and many people know me and trust me, and very easy for that when you have good reputation. Thank you. And it's very easy to do any project, yes, and to invite many people, and for example, such things like I did with harmful habits. It's #1 now here, because many kids, even 7 years old, I spoke with a teacher, and she said to me that 7 years old, they already smoking e-cigarettes, and they take from the parents, and this is a big problem, you know. And I really enjoy it. We been in five or six schools, and we talk, and we really enjoy it. Yes.
Sorry, I was on mute. That's really great. And I think hopefully that lets people know that it's not that hard to reach out to local government and to invite them. But they can be really useful when you want to access education systems or access communities. So I think that's something for people to bear in mind for their own events.
You know, it's if you really want to do something really light in this world, and many people to support you, you know, when they see through it, when you're clear and you're transparent, and everyone would like to help you. It's 1,000,000%, I know that.
No, that's really great. I think sometimes people feel intimidated by the idea of government, but actually they're people, and they get excited by the same things that we do. So I think you've really shown that in your project, Ludmila.
I would like all projects where I participated, I invite government side, and they with very big moods would like to help us, and our project became more bigger, you know, without money, just by people, and some of them invest. Some of them would like invest and said, don't tell anyone, I just will help. Okay, no problem. Yes, and we're happy about that.
Great. Well done for getting such great support. I'm going to answer one question from the Q&As, and then Pamela, I've got a question for you afterwards. So how much time do you have to implement the project? That's a very good question. So we do ask that the projects are implemented by the end of September 2025. Again, we ask for this focus around the 25th of September, which is World Lung Day. We realize that people can't always deliver it on that day, and it depends on the nature of the project as well. But I would say certainly within 12 months, but really looking at 9 months. I hope that answers your question. Pamela, I've really had some nice questions. Well, a good question for you. It's great that you managed to vaccinate so many people, and you mentioned vaccination hesitancy. And I was just wondering, from the experience you had, what was the main objection to vaccines, and were you able to overcome those objections, or is that an issue that's still within the community that you might want to look at another time?
Thanks for that question. So in some communities, some households, they're known to be vaccine hesitant, and mainly because of maybe their beliefs, religious beliefs or traditional beliefs. So in the area that we worked in, there were some households that were known to be vaccine hesitant. And the vaccine hesitancy stems from traditional or religious beliefs. They don't believe in vaccines.
Mm.
And the way we handled that was to engage their clan leaders, community leaders, and kind of like try to give them more information on the importance of vaccination. Yeah, more like advocacy. Yeah.
I guess it's quite hard. I mean, you're not necessarily going to be able to change people's minds, but I think it's still great to be able to offer it, should they decide to take it up. And yeah, I guess that's all you can do really, but it's a really wonderful project that you were running. So thank you so much.
Thank you.
Do we have any more questions from the audience? I think we've got no more open questions left. Is there any questions anyone would like to ask about the grant application process or about the projects that we've heard from today? Okay,
I have one question. Okay.
Yeah, please.
The question is, okay, for example, if somebody already participated before, they have chance to participate again, or you just will give for people who just first time participating in this project?
So we've asked that people, once they're successful, don't apply again for a couple of years. And that's because we want to give other people the opportunity. We changed that last year because we realized that we would often get the same people coming back. And I feel like that's not necessarily fair when there's lots and lots of different projects that can do with the support. So yeah, I mean, I think that's going to stand again this year. So if you did get a grant last year, please don't apply this year, but don't forget to apply again in the coming years, because it doesn't mean we won't support you again. Obviously, we wish we had enough money to support everybody, but it's quite a limited pot. And we get about 100 applications each year now for the 10 grants. So it's quite a lot that we have to go through. Also, every year we see higher quality applications coming through, which is wonderful, and it's so lovely to have this as a problem, seeing all these great projects. But it does mean that we have to turn more people away, unfortunately.
Okay, well, if we would like participate again, and if you will give chance for another people, will be mad or sad or something like that.
No, exactly. You can come back, but not this year, but in another year or so. But yeah, no, I think we really do love running this grants program. I don't know if Pamela or Abdul, you've got any more comments you want to make for everyone today? Okay.
Hello.
Well, hi.
Yes, thank you so much for the invitation. I really feel humbled to be part of this, because I'm not one of the people who passed through when I applied last time, but I'm humbled for having been invited to attend this meeting, because I've been able to learn what really entails with lungs health. And for those that have shared a few slides, I don't know whether it is possible for them to share some of their information, so that we who have not applied and gone through, be able to look through what exactly they were able to participate in. Maybe it can help us to design our projects better and be able to share good stories in the coming times. Thank you so much.
I think that's a great idea. Certainly we'll put the video for this event up on the Healthy Lungs for Life page. But are you happy for me to also share presentations? If everyone's happy, and I'll put those up as well, so that will hopefully give you the resources that you need. And do feel free to get in touch with any other questions as well after the event.
Yeah, sure, no problem. No problem.
Thank you very much, Abdul. That's great. Any more questions? Okay, well, I think maybe we'll finish the event a bit early. I think you've obviously everyone's had what they needed from the event, which is wonderful. And I think Nadine was just sharing the contact details. So if you do want to get in touch, here's my email address. Also, go onto the European Lung, the ELF website page, and scroll down to the bottom, and that's where you can sign up for the newsletter. It's very good to have the newsletter coming in because it tells you when the grants get released, but also we like to share stories of previous grant awardees through the newsletter as well. So potentially more inspiring content. And thank you everybody for joining today. Thanks for making the time. I look forward to seeing everyone's applications, and let's keep in touch, and we'll hopefully see you all again soon. All right, thank you so much. Bye.